Senator, number one, a point of encouragement. Please tell your colleagues why on earth are they so worried about the next election if they're not going to fulfill the mandate from the prior election? And then secondly, just what do we, the grassroots, have to do to try to get this done? Not just defunding Planned Parenthood, but some of the things that we ran on and that we hope to expect, so that this doesn't end up being just a lackluster reconciliation bill that blows this great opportunity. Senator, please.
The Planned Parenthood is sticky. And as a father of 6 kids, 3 adopted, I thank God almost every day that the mothers that were able to give me these 3 kids that I can love and they love me, and was brave enough to go through the pregnancy. I am 100% pro-life. What Planned Parenthood has done is they've weaved themselves into our community health care centers. A lot of our rural areas are that doesn't have a hospital, doesn't have 24/7 urgent care or any really medical. They run the only community health care center in maybe the entire county, and trying to separate those around. And so when people start saying funding Planned Parenthood, what ends up happening is through these community health care centers that doesn't deliver abortion at all, the problem is we feel like Planned Parenthood is using that money that is typically derived by Medicaid and Medicare recipients, because it's rural areas. They're following that money into their abortion clinics. There's 2 paths here. One, you just completely get them out of it where they can't accept Medicare and Medicaid at these community health centers, which would be pretty devastating to the rural areas, or you get them completely out of the business altogether. But then there's supposed to be a clear line between the funding between the two. And the Democrats have allowed that funding to mesh together during COVID. And we have to expose that. And if they're not willing to do that again, then we need to kick them totally out of the system and allow them to have Medicare and Medicaid. That's what so that's the biggest issue is.
No,
it's about losing health
and I think that's
in the rural area.
No, yeah, and we're running out of time. Senator, I think that's a smart point I haven't heard before, and I understand the complexity. Let me just kind of tell you the political and moral dynamics. Kick them out completely. And by the way, call their bluff. Why isn't that pregnancy crisis centers in Tulsa and in Edmond and in Oklahoma City, which are these Christian amazing communities there, they don't get any funding from the federal government. So if these pregnancy crisis centers that do this incredible work that are saving lives don't get money, why should those that butcher lives get money? So I think you should kick them out completely. And look, the audience is on fire about this one.
For full shows, live and on demand, it's Salem News Channel.